Welcome back to Joint Ventures, an OSC original podcast, where we break down the latest in orthopedic science and sports medicine for real people who want to move better, live better, and stay active for life. I'm your host, Boyd Haynes, and today we're tackling one of the most common and important questions in orthopedic surgery. How long do knee replacements actually last, especially for younger, active patients? Well, a groundbreaking 40-year study from the Hospital for Special Surgery just dropped, and the results might surprise you in the best way possible. For years, there's been hesitation around recommending total knee replacements to people in their 40s and 50s. The big concern has always been, if you're active and get the surgery early, won't you wear out the implant and need another surgery? Maybe in 2 or 3 surgeries? So Dr. William Long and his team at HSS decided to put that theory to rest. They tracked a group of patients ages 33 to 55 who had total knee replacements between 1977 and 1992. That's right, this was a 40-year follow-up, the longest and largest study ever done on knee replacements in younger adults. And what they found was pretty incredible. After 4 decades, 70% of those patients never needed a revision surgery. Let me say that again. 7 out of 10 people still had their original knee implants in after 40 years. And here's the kicker. These weren't the advanced implants we use today. They were early models from the 1970s and 80s called the Burstein 1 and 2 designs. Even more impressive. Among the group who received the very first generation, the Burstein 1, 80% didn't need revision surgery. Think about that. These prostheses held up remarkably well. Even with decades of use, even with active lifestyles, it's pretty amazing. Now you might be wondering, okay, the implant lasted, but were these people just sitting on the couch the whole time? Actually, no. Researchers used something called the Tegner Activity Scale to measure physical function over time. Before surgery, these patients averaged a score of 1.5, which meant they could walk on uneven ground and maybe work a desk job. But that was about it. Fast forward 40 years, and the average jumped to 2.7. That means they were out walking in nature, swimming, and even doing some light physical work. So not only did the implants survive, they help people thrive. So what's the takeaway? If you're holding off on knee replacement surgery because you're worried it won't last, this study should give you some peace of mind. Early intervention can actually lead to better outcomes over time, not just in durability, but in the quality of life. And remember, these were old school implants. Modern replacements are even better. Today's design materials, surgical techniques have come a long way. The chance of needing a revision now, even lower. As Dr. Long put it, young patients can be confident their knee implants will allow them to pursue a high-level activity and more than likely last the rest of their lives. So if you're in your 40s or 50s and struggling with knee pain, this might be the sign that you've been waiting for to talk to your orthopedic surgeon. Ask questions, explore your options, because your best years might still be ahead and a new knee could help you live them to the fullest. Thanks for joining us on Joint Ventures. If you found this episode helpful, be sure to subscribe, share it with someone who might benefit, and leave a review wherever you listen to podcasts. We'll see you the next time.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.